Hey everyone, welcome back to Mole and Health. I'm so glad you're here. You know, I'm passionate about making health information accessible, and today we're tackling a condition that affects millions: nasal polyps. Now you might be thinking, nasal what? Don't worry, we're going to break it down. We're going to cover everything from what causes these pesky growths to how they're diagnosed and the range of treatment options available. Whether you're personally dealing with nasal polyps or just want to learn more, stick around. This video is packed with information to empower you to take control of your nasal health. So, what exactly causes these growths to develop in our nasal passages? Well, it often boils down to inflammation. That's your body's natural response to irritation or injury. Think of it like this. When your nasal lining is irritated for a prolonged period, it can become inflamed. Over time, this chronic inflammation can lead to the formation of soft, painless, non-cancerous growths. Those are our nasal polyps. But what triggers this chronic inflammation in the first place? Well, several factors can contribute, including chronic sinus infections, allergic rhinitis, that's your hay fever, asthma, and even sensitivity to aspirin. Nasal polyps can be sneaky, sometimes causing mild or even no symptoms. But when they do rear their heads, they can really impact your quality of life. One of the most common signs is a stuffy nose, and we're not talking about your average cold here. This stuffiness can be persistent, making it hard to breathe through your nose. You might also experience a runny nose, a reduced sense of smell. Imagine not being able to fully enjoy your favorite meal. Frequent sneezing, facial pain or pressure, and even snoring or sleep apnea. If you suspect you might have nasal polyps, the first step is to see a doctor, preferably an ear, nose, and throat specialist, also known as an ENT. They'll start by asking about your symptoms and medical history. Then they'll likely perform a physical exam using a tool called a nasal speculum to gently open up your nostrils and take a peek inside. To get a clearer view, they might use a nasal endoscope, a thin, flexible tube with a camera. In some cases, imaging tests like a CT scan or MRI might be needed to rule out other conditions. The good news is that there are effective treatments available for nasal polyps, ranging from medications to surgery. Your doctor will recommend the best course of action based on the severity of your symptoms and the size and location of the polyps. Medications like nasal corticosteroid sprays are often the first line of defense. These sprays help reduce inflammation in the nasal passages, shrinking the polyps over time. Even after successful treatment, those pesky polyps can sometimes make a comeback. But don't worry, there are things you can do to minimize the risk of recurrence. First and foremost, be diligent about those nasal corticosteroid sprays if your doctor prescribes them. Managing any underlying allergies is also crucial. Identify your triggers and try to minimize exposure to them as much as possible. That might mean investing in dust mite covers for your bedding, or using an air purifier. That's it for today's deep dive into nasal polyps. I hope you found this information helpful. Remember, knowledge is power when it comes to your health. If you're experiencing any of the symptoms we discussed, don't hesitate to reach out to your doctor. They're your partner in navigating this condition and finding the best treatment plan for you. Don't forget to give this video a thumbs up if you found it informative. Share it with your friends and family, and hit that subscribe button for more evidence-based health content. Until next time, stay healthy, friends.